everyone, Overlord here. You may have noticed that our channel hasn't released any new YouTube content in the past, I don't know, couple weeks, couple months. A big reason for that is I am the one who typically puts together our YouTube content. I do all the editing, and most of our YouTube content is actually me playing some games. But what you may not have known or realized is that I was diagnosed with a frozen shoulder. It has been affecting me for a little over a year now. It's a very painful condition. It's kind of restricted how much gaming time I could have, how much I could sit at a computer. While I was suffering with this frozen shoulder, I was still going to work full time. Our little YouTube and streaming is all stuff that we do after hours. So I was exhausted. I was in a lot of pain, and that just limits the creative juices. So I am now 3 months post-surgery, and I'm happy to say that I got the all clear. I've been feeling a lot more like myself, and so hopefully I'm going to start doing some more YouTube content to pick up the speed on our channel again. So I created this little presentation about the costs of treating a frozen shoulder because I thought maybe some of our viewers out there may have this condition or may have a friend or family member going through the same thing, or maybe you're just a random person who stopped by because you saw the term frozen shoulder in a search and it put my video in front of you. Regardless, I wanted to be able to kind of go over what I've been going through and maybe demystify the whole frozen shoulder thing. So this is my experience from diagnosis through surgery, because I actually had surgery. So before I begin, this is not medical advice or advice on treatment plans. This is merely my experience with my particular surgeon, my particular physical therapist. This does not mean in any way that this is going to be your experience. Obviously, everybody's body is different. Your speed of healing may be different than mine. On top of things, I am a type 2 diabetic, so things may be a little bit more complicated for me than they may be for you. So what is frozen shoulder? So when they told me I had a frozen shoulder, I'm like, what the heck is a frozen shoulder? It is exactly what it sounds like. So I stole this from Mayo Clinic. Frozen shoulder, also known as adhesive capsulitis, is a condition characterized by stiffness and pain in your shoulder joint. Signs and symptoms typically begin gradually, worsening over time, and then resolve, usually within 1 to 3 years. That's right, 1 to 3 years. When I was diagnosed, the doctor's like, well, we can send you to a surgeon, or you can just wait it out. It will eventually thaw. The problem is you have no use of your arm. When it says frozen shoulder, that is exactly what happens. There's this nice little capsule around your shoulder joint, and it literally freezes, which restricts all movement of that joint. So you can't move your arm even if you wanted to. It's like stuck in a vice. You can't move it. And for some people like me, it's also very, very painful. So that's what a frozen shoulder is. Capsule around the joint freezes, and it can take 1 to 3 years before it gets better on its own. So for me, in my experience, I had 3 phases of treatment. I broke it down to 3 phases. First was getting diagnosed with the frozen shoulder. Then I was referred to physical therapy for a period, and then there was the decision to go into surgery. So the diagnosis, I was in pain for months. I would estimate it was about 6 months of it slowly, gradually getting worse. It started off with just twinges of pain reaching for something in the pantry. And eventually I noticed I couldn't reach as high. And then I noticed I couldn't shampoo my own hair with both hands because I couldn't raise my shoulder to do it. So over the course of 6 months, the pain increased. The range of motion started limiting even more. Like a clamp, a vice. You know, one day I could reach and the next day it was a little less. So I slowly lost the ability to move my arm. I scheduled an appointment with my primary care. What prompted that appointment was I could no longer sleep. The pain was constant. Even just laying in bed, it hurt. So at that point, when I realized that I couldn't even sleep, I couldn't even lay down, the pain was waking me up in the middle of the night, I went to my primary care doctor. Almost immediately, in the little exercises he had me do, he diagnosed me with frozen shoulder and then referred me to an orthopedic surgeon. So in my initial appointment with the surgeon, he confirmed that I did indeed have frozen shoulder. And in addition, he took x-rays to ensure that there were no bone abnormalities or anything else that was contributing to the pain. I guess there could be fractures or bone spurs or an abnormality of how your joint fits in the socket. Anyhow, he ruled out all of that with an x-ray. So I did get an x-ray done. I'd like to say that I never got an MRI done. And I know that some surgeons do MRIs if they suspect tears or anything like that, but nothing gave my surgeon the impression that this was something more than just a frozen shoulder. So as we sat there, we got the results for the x-ray almost immediately. He took x-rays before I even saw him. So that was the first step, x-ray, then the appointment, same day. Like literally took the x-ray, 10 minutes later was my appointment. And within somewhere middle of the appointment, my x-ray results came back. So once we discussed that, he recommended that I do 3 months of physical therapy and then follow up with him in 3 months. So I would like to think that he took a very conservative approach, which was fine by me. I would rather have a surgeon try things before just saying, yeah, let's cut you up. So that was what we decided to do. So the first 3-month round of physical therapy, my treatment plan was twice a week for a month and then reduced to once a week for 2 months. I had absolutely no improvement in pain or range of movement. And I'll discuss more about this first round later on, but just keep in mind that I did everything that I was supposed to. I bought a door pulley and did those stretches that physical therapist told me to do religiously, but still no improvement in pain or range of movement. So when I went to my 3-month follow-up appointment, he did the same little evaluation test and said, okay, yeah, no improvement. So he gave me the choice between another 3 months of physical therapy or trying a cortisone shot. At that point, I was very discouraged by physical therapy. I'm like, I'm paying a lot of money for it doing absolutely nothing. So I agreed to get the cortisone shot, and we scheduled another 3-month follow-up. So my surgeon was very good about going over the potential hazards of cortisone shots. He said that my pain would decrease, it would reduce that inflammation, it may give me some more movement and may help me move toward thawing my shoulder out. But at the same time, there are some dangers to those cortisone shots. They are not a fix all. Some people just want to get the cortisone shots because they no longer hurt, but at the same time, it can cause additional scarring. So there are definitely pros and cons to getting cortisone shots, so make sure that your surgeon goes over that with you. And if they don't, ask about it or do your own research. They are not they are a temporary band-aid. They are not a solution. So I got the shot. If you're wondering, it didn't hurt me at all. Just felt like I've given blood before. No worse than that. She lined it up, did her thing, took 5 minutes. I was in and out. I didn't have any additional pain. I think there was a little bit of swelling. That was it. So nothing too painful. Not like I've heard about, getting those in the knee or some other places. Definitely the shoulder was not bad at all. So I returned to physical therapy for another 3 months. So this is now 6 months after my official diagnosis. So this is roughly about a year of me living with this frozen shoulder condition. And the entire time it was frustrating. The entire time it hurt up until I got the cortisone shot. The cortisone shot did remove the pain factor, but did not improve my range of movement. So 6 months of PT, one cortisone shot, no improvement in range of motion, but I did have improvement in pain. So when I returned after 6 months, I did the first course, 3 months course of PT, got the shot, did another course, 3-month course of PT. The surgeon gave me the choice of getting another shot and another 3 months of physical therapy, or to just skip right to surgery. So he went to go see another patient. He gave me about 5-10 minutes to kind of really think it over. He gave me as much information as I needed about the dangers of me just, while it's the more cautious choice to forego surgery and then hope that another cortisone shot and more physical therapy would cause some movement, there's still the risk that shot would make it worse, because cortisone shots can cause scarring on its own. So I decided to go ahead and go with surgery, because at that point, he told me it may be another 1 to 3 years of me doing physical therapy on my own at home before it decides to thaw. And he's like, can you really afford 3 years without using your dominant arm? And so the more I thought about it, I ended up choosing to go ahead with surgery. So I had my surgery on February 6th. The procedure I had done, I actually had 2 procedures done. The first one was manipulation under anesthesia, and it's just as it sounds. They put you to sleep, and they forcefully move your arm to break up the scar tissue. And in fact, I believe my surgeon says, yeah, when I do it, it sounds like popcorn. Did not make me feel good at the time. That kind of made me nauseated. I'm like, yeah, he was just smiling. Yeah, it sounds like popcorn popping. So yeah, they put you under, they force move your arm. And then because my case was so bad, the fact that 6 months of physical therapy did absolutely nothing. We also went ahead and did a shoulder arthroscopy. And I think those go hand in hand. I think some people do both. I think some just do the manipulation. At least when I did my research, that was my understanding. One procedure is not dependent on the other, I guess. Anyhow, I'm not a surgeon. Regardless, we did the 2 procedures. Got some cool pictures of the scar tissue in my arm. It was pretty bad. After I was done through surgery, he did tell my husband that it was pretty bad, and we made the good, made the right choice, that what it looked like probably would not have thawed on its own anytime soon. So another thing that they did was they applied a nerve block to my arm. I don't know if that's standard. That may be something to ask about, but they pretty much block the nerve on the arm you're having your shoulder surgery on, and you won't be able to move it for a few days. So let's talk post-surgery pain. The surgery itself did not hurt. I had soreness from where the IV was. I had that after surgery grogginess that was uncomfortable. But as we all know, pain is subjective, and I have not had a doctor, nurse, physical therapist now tell me that. They always tell me that I have a high pain threshold. So to ask me if something hurts is probably not a smart thing. Some people stub their toe, and that is the worst thing in the world. And me, probably it's like a 1 on my pain threshold. I can take quite a bit of pain. So I'm not really the person to ask about post-surgery pain. But for me, I was sore, but mainly uncomfortable, and I hated the dead, numb arm. I almost would have preferred that they did not numb my arm and just let me suffer through the pain. That's how much I hated it. I hated my arm just dangling there. So, recovery. So, at this point, I've been suffering with the frozen shoulder for a year. And then I got my surgery. Let's talk about the path to recovery. So, within hours of surgery, I had a physical therapy session. I was done with surgery about noon, had enough time to pick up medicine, enough time to take a nap, and then I was right back at the physical therapy clinic, one floor above my surgeon's office. So, again, the recovery schedule is different for every surgeon. They all have their preferred methods. So, what I have to do may not be anywhere near what you have to do. And that all has to do with how bad of a case you have and your surgeon's preferred methods. So, again, don't take this as a page out of the Bible of surgery. This is just my personal experience. So, within hours of surgery, I had a PC session where my new physical therapist explained a few stretches and exercises that my husband can help me do while my arm was numb. So my recovery physical therapy schedule was that I would have PT every day for 3 weeks. So that's 15 sessions. Then 3 times a week for 3 weeks. So that's another 9 sessions. And then 2 times a week for 2 weeks. So that's another 4 sessions. And then once a week for 4 weeks. So another 4 sessions. So as you can see, that is 3 months worth of physical therapy, some multiple times a week, down to gradually tapering off to once a week for 4 weeks. What I would like to say is, if you've happened to stop by here considering this surgery, if you aren't going to commit to at least 3 months of physical therapy, do not get the surgery. It will be a failure, and it would be a waste of the surgeon's time and a waste of your time, frankly put. If you are not a person that can stick to the schedule that the surgeon is going to give you, don't fool yourself. If you have a habit of not doing things for your own health, don't get the surgery. And I mean, I'm just going to be frank about that. So, post-surgery physical therapy, what is it like? The surgeon is not going to tell you what it's like, because the surgeon's not the one doing the physical therapy. They will give you some canned response about how many sessions you're going to do, and that, oh, they're going to teach you stretches and exercises, and they're going to work on your arm. But in my experience, no one really tells you what's going to happen in physical therapy other than how many times you're going to be going. So the first 3 weeks are brutal. If you do not like pain, you are not going to like the first 3 weeks of physical therapy. Their whole goal is to make sure that new scar tissue does not form in those 3 weeks, because the whole surgery is basically treating trauma with more trauma. And the only way to get that secondary trauma from not creating more scar tissue is to move it. So the first 3 weeks are brutal. They will push your arm as far as it can possibly go at the highest amount of pain tolerance that you can take. So imagine yourself laying down on a physical therapy table, and 1 to 3 therapists, depending on your condition and how far you can go, will be holding you down on the table so you don't slide off, while one is holding your scapula, while the other is pushing your arm as far up and or out as it will go, and then holding it for 5 to 10 seconds. Unfortunately, there's no way around that. And again, I think it really has to do with your individual body, but it's going to hurt regardless. It's going to hurt. And it isn't necessarily where the surgeon inserted his equipment. It's just that whole capsule on your shoulder isn't magically fixed by the surgery. They've just removed some scar tissue. They've broken up the scar tissue, but it still doesn't mean that that capsule around your shoulder is pliable yet. So that's what they're doing. They're trying to make that capsule around your shoulder pliable again. So that just takes some stretching. And so it will be brutal. They are putting you in pain purposely, for the purpose of stretching out that capsule, and there's just no other way around it. On top of that, you must push yourself at home. And I have to stress this. If you stumbled onto my video because you want to know what the surgery is like and what post-surgery is like, if you are not going to commit to doing your physical therapy exercises and stretches at home, don't get the surgery. You would have put yourself through a surgery for no reason. Your surgery will fail. For me, every hour on the hour, I was doing a combination of the exercises and stretches that my physical therapist gave me. After a week, I was able to return to work. But my coworkers will tell you that, I had yoga bands, I had a door pulley on my office door, and every hour I was doing one or two different stretches and or exercises. Every chance I got, I was stretching out my shoulders. Pretty much all day for the first 3 weeks, all I could think of was, I am not going to let the surgery fail. And so I did all the PT that I was told to do and probably some more. So again, if you're not going to attend physical therapy as your surgeon instructed, and you're not going to commit to doing at home, and you're not going to commit to buying the equipment yourself, don't get the surgery. It'll just fail and it'll be disappointing to you, and you would have wasted a lot of money. So make sure that you can commit to the post-surgery PT. Also, make sure you feel comfortable with your therapist and their approach. So I said I was going to come back to this. I really liked my first physical therapist. He was a great guy. He was funny. I felt comfortable around him. But in that 6 months that I had seen him, he never tried anything new. And so now when I moved to a new therapist post-surgery, she tried everything in her arsenal of weapons that could possibly be of any help to me. She tried it. And so I can't help but think, if I had her in the first 6 months, whether or not I would have ended up getting this surgery. So picking your physical therapist is important. If you get a physical therapist that keeps just doing the same thing day after day after day, even though they're not seeing any improvement, and they don't introduce any kind of new technique or new procedure, might be time to find a new physical therapist. But me not knowing what I didn't know, I thought he was doing what he was supposed to be doing, and maybe he was. But I still think if I had my current physical therapist, that maybe I would have delayed surgery, or maybe I wouldn't have needed surgery. So make sure your therapist is pulling out all the stops. So the biggest question may be, how much did it cost? So this is all billed cost, this is pre-insurance. So the surgery itself was billed at $15,000. And the cost for the anesthesiology, which was the nerve block and putting me under and everything associated with that part of the surgery, was $6,000. So the total cost of my surgery was between $21,000 and $22,000. Thankfully, for with insurance, I only paid $2,000 out of pocket. Now, for me, physical therapy is not included in the cost of surgery. So that is something to research if you're considering this surgery, on whether or not your physical therapy is considered part of the surgery. For me, it was not part of the surgery costs. So my copay for a physical therapy visit is $100 a visit. We had scheduled 32 visits over the span of 3 months. So out of pocket, I paid $3,200 in copays just for physical therapy. Now, what I'd like to add here is that that's not all I paid. So here in the last 2 weeks before I went to my final checkup, my physical therapist tried dry needling, and that cost me $40 copay per dry needling procedure. So we can add another $80 to that. So $3,280 is what I've paid to date out of pocket. So I am currently 3 months post-surgery. I received the all clear, which means I no longer have to go back to the surgeon. He considers my surgery a success. I've hit all the benchmarks that I need to prove to him that it is not just, I'm not producing any scar tissue. I've kept progressing in the right direction, so he feels like I'm all clear and that I don't need to go back and see him. He told me to continue doing my PT exercises at home, and it could be a year before I regain full mobility. So I can reach again. I can do my hair again. It's still stiff. It is definitely not 100%, and I can definitely see why he said it could be a year before I gain that full range of motion. I still can't really reach behind my back, but it's slowly getting there. And according to my physical therapist and him, that's like the last thing to come back. So I'm on par for a successful surgery. If this is a surgery you're thinking of getting, or you're researching, or you have frozen shoulder and you wonder how bad it can get, this is pretty much how bad it can get. My case was pretty bad. Many people can start doing physical therapy in the first half and all of a sudden it starts thawing. But mine stayed pretty locked for that whole year up until the surgery. So it's really a choice of whether or not you want to wait that 3 years. And I did not want to wait 3 years. So if you ask me now, was it worth it? I'm still on the fence. The last 3 months of physical therapy was rough, and I would not wish that upon my worst enemy. Really committing to the physical therapy was difficult. Moving it as high and as hard and as I could every day, putting myself to the highest threshold of pain that I could take was hard. There were times of physical therapy that they had to ask me, "Are you blacking out?" Because they will push you to that point. As long as you can take what they're doing, they're going to do it, because there's just no other way. So if you're wondering whether or not the surgery is, you get the surgery and you're automatically fixed, that is not the case with this surgery. At least for me, you've got a long road to recovery, but at the same time, I'm here at the end of that 3-month post-surgery window, and it's still stiff. Some days I wake up, it still kind of hurts, but I have movement, and I have to rebuild strength. I lost a lot of my fine motor skills. I like to draw, and even writing my name, the loops and curves in my handwriting is horrible right now. And I have to gain all of that back, just because you don't realize how much your shoulder is a part of that whole process. And so there's a lot of retraining of my arm what to do. And as the surgeon said, it could be a full year before that all comes back to where you remember it being. So it was not an easy surgery. But if you're like me and didn't want to wait 3 years, it is what it is. You're gonna go through some pain and some recovery.
Hey everyone, this is Overlord. If you like today's video, please like, share, and subscribe. If you want to follow us on our other social media, those links will be down below in the description. We'd also love to hear from you, so don't be afraid to leave a comment down below. Until next time, bye!